Hi everybody, my name's Courtney Burrow and I am an MSSW candidate at University of Louisville Kent School of Social Work. This is my culminating assignment video. The assignment was to pick a social problem that was important to us, and so I'm going to talk to you a little bit about mental health treatment in the community, outpatient and inpatient actually. The problem that is nearest and dearest to my heart is mental health treatment. So right now I work in the emergency room of a level 1 trauma center, so I get to see a lot of mental health patients there, but previously I worked in outpatient care, so I kind of know the spectrum of care. And what I learned while I was in grad school had a lot to do with applying best practice research to what I'm doing. So the problem that I focused most on was lack of treatment for mental health patients, lack of inpatient beds, lack of outpatient care, and a lot of it has to do with inability of the patient to follow up due to mental health symptoms, non-compliance with treatment, alcohol and drug addiction. There are so many variables in mental health treatment. But my big idea that I addressed in my paper is a mixture of a nursing home and a group home. So many of the patients that I see struggle with homelessness, getting arrested for criminal trespassing, sleeping in abandoned buildings, getting kicked out of shelters, and having nowhere to go. And we know from Maslow's hierarchy of needs that without reaching those very basic needs, a place to stay, somewhere to be safe and secure, without reaching that, those patients will be unable to ever know and understand their diagnoses and be able to care for themselves on a level that they maybe could otherwise. So I would love to someday be able to implement a housing structure that encompasses medication management, a psychiatrist, a physical health doctor, nurses, case managers, therapists. I know that the big pushback that I always get when I talk about this is about funding. But I think that if we think about the amount of money that we currently spend trying to take care of our mental health patients in an outpatient setting and the times that they end up inpatient in the hospital, whether for medical or psychiatric needs, the times that they end up in jail, the times that the money that we pay for their food assistance, the money that we pay for their Social Security because they are unable to work, all of those things factor into how much money it costs for us to try and take care of them in an outpatient setting. And from what I've seen and from what the research says, it's just not feasible for us to take care of people in that capacity. I know the whole deinstitutionalization that happened, and I understand why that happened and the idea behind mistreatment and abuse of mental health patients. But I do think that there's a middle ground, and I hope that I can someday help with achieving that. And I do think that the things that I've learned while in graduate school will help me carry through with those promises that I have made to myself and the goals that I have set to be able to take care of mental health patients in a long-term way. So, thank you.